stimulus bill? You notice how it's really helping the economy out? No. They authorize more money than they're paying for the Army, Navy, Air Force, and Marine Corps to finance these people to have instantaneous, real-time access to every citizen in the United States, healthcare records, that's why they want that electronic medical records to be put in, to all of your financial and banking transactions. And I'll tell you why a little bit later. The nonpartisan Congressional Budget Office projects that the cost per year will be $1.2 trillion. I remember the president saying, we will save $2.2 trillion by taking the fat out. Well, the Office of Budget says that no, we won't save. It'll actually cost $2.7 trillion increase over 10 years. They seem to imply that we have a whole lot of people out here who are uninsured. I'm sure no one here understands the regulations that we have right now. If you walk on a hospital ground and you have a heart attack, appendicitis, pneumonia, severe pain, that hospital must take care of you if it has an emergency room, or it's a $50,000 fine. So almost automatically everyone with a serious illness is insured. But let's take the figures that the census put out for 2007. They said that there are 40 million people uninsured in the United States. Of course, they lumped in illegal aliens, people who are young who don't want insurance, also people who are eligible for benefits, but they don't realize it, that they could go for Medicare, Medicaid sign up. And they even put in people who earn over $75,000 per year. We're in that. So it comes down to about 20 million. But let's just take their figure. The same nonpartisan Office of Congressional Budget says that there will be no universal coverage under the Obamacare. The House bill will leave 17 million people uncovered. The Senate bill, 34 million people. So any way you look at it, one, it's not going to cost less, it's going to cost more. Two, more people will be uncovered by this plan, uninsured. So there's no quality of care and no cost containment. Mayo Clinic, and I'll give you a short story on this. This is another nice story. Some brothers off in the middle of a cornfield up in Minnesota. Yes, Mayo Clinic. And they decided to give excellent care. And it was so excellent that they became world famous. At the end, they donated all their money to the Mayo Clinic to give affordable care to their local citizens. Listen to what Mayo Clinic says, because the administration says that they're modeling this after the Mayo Clinic model. They say, the proposed legislation misses the opportunity to help create higher quality, more affordable health care for patients. In fact, it will do the opposite. The real losers will be the citizens of the United States. Once again, the Congressional Budget Office says, and this is the CBO director. Remember, this guy was placed in his position by this Congress. He must be having a hard time. Douglas Elmendorf, he testified before the Senate Budget Committee, and he said, the House and Senate bill doesn't have the sort of fundamental changes that would change the cost curve on this country. He said, in fact, the curve will be rising. Let's look at the bill and the processes before us. I can't help but read you some of the actual stuff that's in there. This is a copy of the bill that's sitting on that desk. Downloaded it. 1,800 pages. Page 29, admission. Your health care will be rationed. Page 30, a governmental committee will decide which treatments and benefits you get. And unlike the insurer, i.e. your private insurance, there's no appeal. All non-citizens, illegal or not, will be provided with free health care. Taxpayers will subsidize, listen to this, subsidize all union. And remember, a lot of you all talked in jest about his starting his career as a community organizer. All taxpayers will subsidize all union retirees and community organizer health plans. Page 94, in case you didn't get the idea, Alcorn is mentioned by name. The government will pay Alcorn and AmeriCorps to sign up individuals for governmental health care. Any individual who doesn't have acceptable health care according to the government, when you file your taxes at the end of the year, you will be taxed 2.5% of your income. Now, this is the IRS that you have to verify to. Remember, they are the only people who can put you in prison for debt. Besides that, why should they? Remember, they'll have online, real-time access to your financial information and accounts. They have authorization to just draw it out. You don't have to send them a check. And in case you didn't understand that, page 195, officers and employees of governmental health care bureaucracies will have access to all American financial and personal records. What I want everybody to know here is that I am very much dismayed in how little respect the Congress and some media. Now, I know that a lot of newspapers, of radios, of TVs have read that. It doesn't seem that our senators and congressmen have. Why aren't they saying this stuff? Why are they saying we need this because we're going to help these people who are uninsured? It's not true. We were told that they would have open hearings on all of these meetings and discussion. They would allow at least 24 hours for consideration of the bills. They would consider each bill in depth prior to voting. This hasn't happened. I'd like to say that, one, I think we have, and the world thinks we have, the greatest health care system in the world.